This is a psychology for mentally healthy people, as opposed to trying to fix people who have problems that are major mental illnesses. And the concept is that it's a psychology for mentally healthy people that can create a change in a very short period of time, in 2.5 days. So what we're going to do is we're going to use a technique known as stacking, where we're going to teach mental exercises and then you'll apply them. Mental exercises, you'll apply them, and we're going to stack one on top of another on top of another. And the purpose of this is to create what's called a rapid shift in cognition. Cognition meaning thinking. So the goal is to create a rapid way in the way that you will think, perceive, and feel. Okay? Some of the stuff we'll be discussing is very old. I would say thousands of years old. Other stuff is quite new in the sense. There's a thing known as positive psychology, which has been this very big movement in psychology for about the last 10, 15 years at the most. It's a psychology for mentally healthy people. And what they've done is they've taken things that have been known for thousands of years, like meditation, mindfulness, and they've said, instead of this being like hoo-hoo crazy stuff, let's actually look at this scientifically and see if it has worth, because people who had done things like this said, you know, this had a lot of worth for me, but it wasn't in the scientific realm. So in that aspect, some of this stuff is very old. Other aspects of this, the neurocognitive integration, this is kind of cutting edge stuff, because running on automatic, and how most of us are running on automatic most of the time, and we're not aware that we're running on automatic, this is profound stuff. And by applying it, I've found in myself that it's generated a very positive shift. So that aspect of this is pretty new, pretty cutting edge. A lot of the stuff, the cognitive psychology, and we're going to be doing a few hours of cognitive psychology tomorrow afternoon. That's been around for 25 years. It's been shown to be the most effective treatment for depression. But we're not using it to treat depression, but it's useful for people who just have normal everyday depression, like, you know, the rest of us. And that has been researched, like I say, for the last 25 years, bar none, more effective than medication. That's saying a lot. A talk therapy that's more effective than a pill, right?